And I really believe there is such a sense of urgency around healthcare. I think that's reflected by the turnout tonight, but also a lot of times we really need to remember how rooted we are in this as an issue that affects us personally, right? And I know that in my own life, so many of my decisions have been made around accessing healthcare. I mean, as a young adult and growing up, I grew up in a family where my father ran a small business, and there were just plenty of times we didn't have insurance. And I know that that's a common phenomenon in this country, right? But then, as I got older, there were these vivid memories of, the time my boyfriend got a kidney stone, and we were worried about an emergency room bill. So he treated it at home with marshmallow tea. There's a debate about which is more painful, a kidney stone or labor, childbirth. So it's a very painful thing. We got married shortly after so that he could be on my health insurance plan. I mean, I'm really lucky. I still like the guy, right? But wow, health insurance can dictate a lot about our lives, and unfortunately, there is a flip side to that, which is people stay in marriages that they're not happy with, or even unsafe in, jobs that they're not happy with because of health insurance. And I know today my daughter is 4 years old, and we've been to the urgent care now a few times for popcorn kernels in her nose. And it's $250 a pop, and it is a horrible feeling to think, do I have the money in my bank account to get the health care my child needs? So we're here tonight to root ourselves in these personal experiences and remember how critical it is to think about how this impacts us personally to motivate us to be involved in this fight. And I'd like to bring up my colleague, Zahara, from JFREG and the Caring Majority. Zahara, are you there? Come on up.
Hi, everyone. My name is Zahara Zahav. Can you hear me better now? My name is Zahara Zahav. I'm a community organizer with the New York Caring Majority. The New York Caring Majority, I'll tell you a little bit more about it in a moment, but to start off, we are a coalition of seniors, of people with disabilities, of family caregivers, and of home care workers. And I'll tell you more about what we're fighting to win in a moment. I want to start off by just, like Katie was modeling, really sharing with you all what brings me into this work and what my connection is. We're called the New York Caring Majority because of what we know to be true, which is that the vast majority of Americans, of New Yorkers, of, I'm sure, people in this room have their own personal connection to care. So I'll start off with mine. Very briefly, it is, as you might guess, a much longer story than what I'm about to tell you all, but when I was about 13 years old, I had the really incredible blessing of being able to live with my grandfather. He was aging, he was developing Alzheimer's, and we really weren't able to take care of him in his own house. So he came and moved in with my mom and I. And something that was really incredible about this moment in time is that it coincided with my mom actually going back to school and really having the first opportunity in her life to invest in herself and to grow her education. It was, unfortunately, very difficult for my mom to be pursuing this, taking care of me, taking care of my brother, and taking care of my grandfather. And so a lot of what was happening in our home was actually a pretty intricate network among everyone in our family to really be taking care of my grandfather and making sure that our family was, able to eat regularly, all those things. So one of the things about this moment in time that I just want to be clear about is that it was both one of the most joyful times of my life. I got to spend such beautiful time with my grandfather, learn about him, learn about his life. I learned a lot about baseball. And it was also a really difficult struggle of a time. And our hope with our work that we're going to be talking about tonight, and that you all will hopefully be doing with us, is really in the vision of being able to support people in the way that my family really desperately needed and didn't often have, to support people to have more of the joy of being able to take care of each other, being able to connect with each other and make sure that we have what we need, and less of that struggle and that grind, right? So, the New York Caring Majority, what are we specifically doing? Our coalition, as I said, of seniors, people with disabilities, home care workers, and family caregivers, is really, we are dreaming of a world where care and care work are deeply valued, both in how we understand their importance, but also in how much we're paying home care workers, what home care jobs are like. And so specifically what we're fighting for is to pass single payer with the full inclusion of long-term care, right? Guaranteeing universal access to both healthcare and to home care. And at the same time, investing in home care jobs, making home care jobs a sector where people can both take care of other people's families and also be able to take care of their own, right? And so, very specifically, we're going to talk a little bit more about how folks can get involved, but there is a lot of opportunity to take action with us, meeting with each other, bringing in new people, meeting with legislators, taking action together to really change that narrative, how people are understanding this work, etc. I would love to meet with anyone who is more interested, and I'm really excited for our panel tonight to dig in to a lot more of these issues. So thank you all so much.
And before we hear from a few more folks, we'd like the Borough President to share a few words with us. Thank you for being here.
Thank you so much for this important conversation. I really want to thank Katie and Zahara. I saw them on the street as they were pushing us through the last electoral cycle, talking to some of the candidates and those who are running for office of how do we engage in this conversation around healthcare. Many of you know how important this issue is for me. As here in Borough Hall, we talk about healthcare all the time. As a person who reversed my diabetes by looking at alternative methods of dealing with the healthcare crisis. This is an important conversation, and I don't want to be lost on this conversation as we deal with healthcare for all, is how we have to really unlearn what we learned and look at preventive measures as well. And that's the holistic approach that we're looking to do here in Borough Hall. We have to stop feeding the healthcare crisis. Our babies cannot continue to eat food every day in school that is causing long-term healthcare crisis. We have to stop feeding inmates in Rikers Island food that is promoting and causing diseases. Our hospitals need to have healthy meals as a default, as we get ready to announce with Health and Hospital Corporation. As we push to ensure that healthcare is for all, we must realize that the road we're on is not sustainable. We're going to bankrupt this city and this country if we continue to have a reactionary medicine model that is really not sustainable as the country. You can't continue to see dialysis center open as fast as McDonald's open. We cannot continue to see the high number of diabetes. Flatbush has its own definition of diabetes called Flatbush diabetes. So the goal is not just keep feeding the crisis. The goal is to create an environment that can start here in the borough of Brooklyn of how do we raise healthy children and families. And in those cases where we need health care, it should be health care for all. We won the Senate. We have a Democratic Senate now. This bill has passed four times in the Assembly. The conversation is now going to shift to the Senate and the governor's office, but it must be a dual approach. We must have quality health care. No one should be afraid when they have to deal with a medical crisis. but it's extremely imperative that we change our mindset that real health care is preventive health care. Not going to the emergency room, but doing things in our daily lives that prevent us from having to have hospital visits. My 80-year-old mother reversed her diabetes because she decided to change her lifestyle. She's no longer imprisoned with insulin, medicine. She's doing the right things holistically, and that is the mission that I have as the borough president. I thank all of you who's pushing this initiative forward. It's crucial. When we need a doctor, we should be able to have a doctor, not based on our W-2 form and income, but based on the right to health care and the right mindset. Thank you very much.
Welcome up two of our next speakers, and I thank you all for welcoming them with me, Allison, Julien, and Devki. What's your last name, Devki? They are going to briefly share a little bit more of their own personal stories, which will model for us our next section. So we'll take, I think we have about 4 minutes right now.
Hey, good evening, everyone. Good evening, everyone. Awesome, that's better. So my name is Allison Julien. I'm here representing the National Domestic Workers Alliance. And I'm here to share a little bit with you about why healthcare is important to the constituents that we serve. I, too, used to be a nanny for over 25 years here in the borough of Brooklyn, Manhattan. And understanding as a nanny providing care for the most valuable assets of a family's life, which is their children, I many times had to go to work sick. I many times had to negotiate my health with my employers. And for me, it was really frustrating seeing that as a care provider, I didn't even have the space to take time off of work to take care of my own needs. We went ahead in 2010 and we passed the Bill of Rights for domestic workers, making it the first bill to protect domestic workers here in the state of New York. And in that bill, there's coverage for domestic workers to take time off to take care of their needs. And we're also covered under the Paid Sick Leave Act, which is really important for this community. Why this is important is because many workers like myself here across the city show up to work every day sick. And if I'm sick, the babies that I care for are going to get sick. The families that I'm providing care for is going to get sick. And we have to recognize that healthcare is an important issue for all of us. I still don't understand why healthcare in this country is not universal. And I think that that's why we're all here tonight, to discuss this issue as to why this is important. Currently, I can tell you a story of a worker that I'm currently working with who recently found out that she has breast cancer. The industry that we organize are mainly undocumented women who, when they're providing care for their own families, can't oftentimes provide care for themselves. And this is an issue that we as a community need to pay attention to. There are workers who oftentimes show up to work and they never leave. They leave in a body bag because they didn't call into work sick that morning. They end up dying on the jobs. These are stories that we don't talk about across our communities. We don't talk about these stories in this industry. And it breaks my heart that I have to stay here to talk about how terrible it is, the problems of healthcare within our community. And I know it's not only in the domestic worker industry, but it's in so many industries across this country. And I feel like together as we continue to lobby and legislate for healthcare for all of us, it's an important victory that we will win because all of our lives depend on better healthcare. Thank you so much.
Hey, good evening, everybody. So my name is Joshi. I'm a proud graduate of CUNY Brooklyn College, and I'm currently a fourth-year medical student at SUNY Downstate in Prospect Lefferts Gardens, and I'm planning to go into obstetrics and gynecology this July. So I've had the immense honor to train and serve patients here in Brooklyn at Kings County, Downstate University Hospital. My mom is a Methodist. So no matter which that healthcare setting may have been, for-profit or public, private or safety net, I see patients needlessly suffer because they can't afford their prescription medications, procedures, and treatments. What's the point of my training if the system does not allow me to apply my learning to practice? It's absolutely infuriating. I'll share 2 stories with you guys. On my surgery rotation, I met a woman who came to the clinic because of a growing mass on her neck. It was likely thyroid cancer, and actually it was a cancer that could be treated. However, first we would have to confirm what type of cancer it was through a biopsy. So the clerk walked in and shuffled through some paperwork and let us know that the patient couldn't afford the $15 copay for the procedure that day. The patient walked out of that clinic without the biopsy, treatment, management, and we didn't see her again. So the first day we come into medical school, we put on a white coat and we take the pledge to do no harm, yet we're constantly complicit as providers in sustaining a system of harm. And then just 2 weeks ago, I had a patient who was a 65-year-old retired man whose kidneys were no longer holding up. Without intervention, he would have likely weeks to months to live. We took the time to discuss dialysis with him. That was his best option. And without skipping a beat, his first question was, how much will this cost me? He had no desire to leave his family in debt. With his life on the line, he could only think about what he could do to not be a burden to his loved ones. So to be a compassionate physician, I need a system that allows me to provide compassionate medicine. These barriers to care make the crushing difference between life and death, which undoubtedly have a ripple effect on family units, to communities, and to our nation as a whole. There's no doubt in my mind that the New York Health Act is a necessary, logical, and compassionate step forward for New York State. I have full confidence that together we can achieve it.
Thank you very much for your stories. We're going to take a few minutes now and really, as was just modeled, as we heard about workers, about doctors, about family caregivers, seniors, people with disabilities, we're going to find and share for a few minutes together our own connections to these issues.